Hello, everyone. My name is Professor Flourish, and today I'm going to go over some helpful tips for MedSurg 1. One of the first tips I want to talk to you about is the Matter Study Method. So basically what the Matter Study Method is an acronym for manifestations, assessments, test, treatments, expected outcome, and risks. So anytime we go over disorder, you want to know each of these things about the disorder. Manifestations are basically what causes the condition. Assessment is both subjective and objective cues. So we want to know what is the patient saying, as well as what do we see when this patient has this condition. Test to diagnose the condition. So any sort of lab test, any sort of CT scans, anything that can give us an indication of what's going on with this patient. Treatments, what are we going to do about it? Nursing interventions, medications, just general things that we can teach the patient. Expected outcome. So what do we think is going to happen if we do all these treatment plans? Nursing evaluation. Did the treatment we give help or did the treatment not help? Risks, complications, worst case scenario. So sometimes, for example, we can give a chemo agent and we end up having a reaction to said chemo agent. So we need to also know what it can happen when we try to give care in these worst case scenarios. The next helpful tool is just keeping memorization to a minimum. So basically, you don't want to memorize anything. You want it all to be very much just an understanding of it. Now, things that you can memorize would be things like growth and development milestones, crisis interventions. We want you, without a doubt, to know what to do if somebody goes into cardiac arrest. Lab values, what I will say is understand more like the critical lab values. You don't necessarily need to know every single range under the sun. You just basically want to know like key points. Like if you've got a potassium of 2, you want to, without a doubt, know what to do in that situation. Drug classifications, immunizations, stages of death and dying, principles of teaching and learning, stages of pregnancy and fetal growth, and Nurse Practice Act. So standards of practice and delegation. What can you and can you not delegate? Something else is your types of questions that you may see. So one type of question you may see is the ABCDE method. By far, I think most students like this method because it's your quick, which patient can I save first? So you have A for airway, B for breathing, C for circulation, D for disability, and E for exposure. So airway is basically if you've got somebody choking, they're going to lose air within 3 minutes. You see them first. Because even if it's a family member, no matter who it is, if I have an airway problem, they come first. Breathing is somebody who has, let's say, really, really bad COPD. They can't get any air into their lungs. So they're going to be seen next because you've got about 10 to almost 30 minutes. Circulation, those are your things like your heart attacks, your myocardial infarctions. And for your heart attacks, you usually have 90 minutes because it takes 90 minutes to get to the cath lab. Disabilities, that's things like your strokes. And for your strokes, for TPA or TNK, whichever one you want to use, a lot of times you've got 4.5 hours or up to 24 hours if you're doing a thrombectomy. Exposure, depending on the exposure agent, you can actually have up to 72 hours. So that's kind of how you want to approach these is how much time, who do I need to save first? And how can I have the most bang for my buck, I guess. Other types of questions are stable versus unstable. Stable patients, you can delegate. Unstable patients, you cannot delegate. If your patient suddenly drops blood pressure, if your patient suddenly drops heart rate, if suddenly they fall, they just became unstable. They are now your responsibility. And then you want to do least invasive to most invasive. Other types of questions are your Maslow's hierarchy of needs. You want your physiological needs met first, safety and security, love and belonging, and eventually self-esteem. So you want to start with, can my patient breathe? And then once I know my patient can breathe, are they safe from falling? Okay. Do they feel like they are being taken care of? Yes. Do they feel good about themselves? So you just kind of want to follow that pattern. And once again, know your nursing steps in the process. Assessment, you want to gather and verify information. Analysis, interpreting the data. Planning, priority of care. Implementation, delegation, assignment of tasks. Evaluation, compare actual outcomes with expected outcomes. Now, with this, sometimes you'll come across a patient that does not get better, and there's nothing you can do about it. You did everything you could, they just do not get better. Now, with those patients, you have to be very honest with things didn't get better. And the reason we want to know this is because now we need to change our original plan. So it's okay if you get into clinicals and your patient just seems to be getting worse, because you need to report that so we can change our game plan. The other thing you want to do is look for key words, first versus priority versus immediate. First typically is assessment data, priority is typically implementation data, immediate is what needs your attention now. So this goes back to your ABCs. Is the patient hurt? Do they have change in vital signs? So anytime your patient is hurt, they are your immediate concern. If somebody falls, if somebody changes vital signs, if there's something that's going on, you want to do something about it as quickly as possible. The other thing to take in consideration is safety concerns. Safety, safety, safety. Did I mention safety? I cannot push this enough. You want to make sure you are being safe. Perform your least invasive intervention first. Head a bed up prior to putting on O2. Now, I say that with a grain of salt. When you get into Med-Surg 3, there are some disorders that head a bed isn't going to always work the best. So you have to kind of move towards something more invasive. But at this stage, you want to start with the least invasive and then go to more invasive. Assess before action. Always assess. Know what's going on with your patient. Don't just go in there and do something. Think about it at clinical. You don't just automatically walk into a room and start doing CPR. You first see that your patient has coded before you do something. Treat the patient, not the machine. Always look at your patient first, then look at the machine. Do all you can do prior to calling the provider. Assess which patient is at most risk / most physiologically unstable. Look for anything new. So NCLEX loves this word new. Anytime you see new, associate that with unstable, because unstable just equals new, because this is changing. This is something that's abnormal. Use equipment appropriately. So make sure that you're utilizing your facilities. Lifts, if you have it, make sure that you're actually using it. You're not just breaking your back. Follow appropriate delegation assignments. Remember the difference between a UAP, that's an unlicensed assistance personnel, versus LPN, which is a licensed practical nurse. And with your LPNs, don't over or under delegate the LPN. What I find that a lot of students do will either give the LPN everything or they give them nothing. So you kind of want to be smart with how you go about delegation. Read the question first. Make sure to understand what the question is asking. Pick out important information from the scenario. If you've already assessed, don't waste time assessing again. So make sure that unless you've already assessed something, then go back and assess first. But if you've already assessed, you don't have to do it again. Watch out for red flag words. So all, nothing, never, always. Notifying the provider can be a red flag item. Appropriate actions prior to notifying the provider, unless it's something that you absolutely have to have a provider for. Like, let's say you've got a cath lab patient and you lose your pulse. That's something that requires a surgeon. Unless it's something like that that requires them, try to do everything within your scope before you call them. Some common nursing interventions: assess the patient. Remember that comes first. Review medication administration. Provide small, frequent feedings. Recommended fluid, 3 liters per day. Alternate rest with activity and conserve energy. So these are all things that we can do prior to having to get an order to it. Something else to remember is answer based off the question alone. No more and no less. Don't try to add things. And remember that NCLEX is an ideal hospital. So basically, whatever you want is kind of there. This is a hospital where you have enough CNAs, you have enough LPNs, you have enough nurses. Don't try to think too much into it. Remember your basic anatomy and physiology. I cannot stress this enough because if you know what your body's supposed to do, then you can find the abnormalities a lot easier. Critical thinking. Critical thinking is a big part of this. The whole point of NCLEX RN is to try to get us to start thinking critically so that way we can help our patients. And finally, I just kind of want to end it on this, your own health. Make sure you're managing your anxiety. Use positive thinking. Remember, you will be a nurse, you will pass. Set up a study schedule and stick to it. And be in the moment, no regrets. Once you're in there taking your test, be right there, ready to take it. So I hope this helps and let me know if you need anything else. Thank you.